Good day, I be to Prof. Zainal and everyone. My name is Francesca and I am a first year medical student. Today I will be presenting on the specialty I aspire to pursue, which is cardiology. Specifically, I will be discussing the heart, which is the central organ involved in this field. In today's video, we will be covering famous cardiologists, the introduction of the heart anatomy, function and system, cardiac physiology, and the clinical relevance as well as health tips. These are the cardiologists that I look up to. Firstly is Dr. Charles. He is known as the Singaporean's father of cardiology. He developed the Department of Cardiology at the Singapore General Hospital. He as well has established the first coronary care unit in 1966. Today, he is a 93-year-old cardiologist whom still chooses to continue work full-time despite his age. He has proven that finding joy in what you do can lead to fulfilling and long-lasting career. The next one is the American cardiovascular surgeon, Dr. Michael DeBakey. In 1932, he devised the roller pump, an essential component of the heart-lung machine that permitted open heart surgery. By 1953, he developed a technique of using plastic tubing instead of arterial homograph to replace diseased vessels. And in 1964, he has successfully done the first coronary artery bypass, as well as in 1966, successfully implantation of the ventricular assist device, which is a mechanical pump used in support heart function and blood flow in individuals with weakened hearts. The heart is a powerful muscular organ responsible for pumping blood throughout the body. Despite being roughly the size of a fist, it plays a vital role in sustaining life. The heart's continuous pumping actions ensures that oxygen and nutrients are delivered to the tissues and organ. The heart's function is so essential that its failure can mean the difference between life and death. As we can see, the heart is located within the thoracic cavity in between the two lungs, slightly to the left of the sternum in a space called the mediastinum. The heart is covered by a tough membrane called the pericardium that separates the heart from the other structures. If you look at the sagittal view, the heart is located anteriorly of the sternum and posteriorly to the vertebral column. Moving on to the walls of the heart, which consists of 3 layers. So we have 3 layers here, which is the epicardium, which is the outer layer, the myocardium, the middle layer, and the endocardium, which is the inner layer. Epicardium is made up of connective tissues, including the elastic fibers and adipose tissues. It functions in protecting the inner layer of the heart and in the production of pericardial fluid, which reduces frictions between the heart and the surrounding structures during heartbeats. This layer also contains coronary blood vessels that supplies heart muscle with blood. Next, myocardium composes of cardiac muscle fibers, which are responsible for the contractile function of the heart, and is the thickest layer of the heart wall. It is thick because it needs to generate the force required to pump oxygenated blood throughout the body. And lastly is the endocardium, which consists of a thin layer of endothelial cell and connective tissue. This provides a smooth lining for the heart chambers and valves, ensuring a seamless transition for blood entering and leaving the heart. Next is we'll move on to the anatomy of the heart. The heart consists of 4 chambers and can be divided into the atrium and ventricle. So if we look at the upper chamber, there is the right atrium, which receives deoxygenated blood from body cells, and the left atrium, which receives the oxygenated blood from the lungs. While the lower chamber here, we have the right ventricle, which pumps blood to the lungs, and the left ventricles that pumps the blood to the whole body. Other than that, we also have valves. So we have the tricuspid valve, pulmonary valve, the mitral or bicuspid valve, and also the aortic valve. So these valves prevents the backflow of the blood. Next we have is the blood vessels such as the arteries and veins are present. Firstly, we'll look at the aorta, which is the largest artery that carries the oxygenated blood to the body. Next is the pulmonary arteries. This carries the oxygenated blood to lungs. Then moving on, we have the veins. We have the superior vena cava, and the inferior vena cava right here, the large veins that carries deoxygenated blood from the body back to the right atrium. Next is we have the pulmonary veins. So this carries oxygenated blood from heart back to the left atrium. And lastly, we have the coronary arteries. This supplies oxygenated blood to the heart muscles, and coronary veins, they remove deoxygenated blood from the heart and drains into the right atrium. Next, how does the heart pump blood so efficiently throughout the body? It all comes down to the coordinated contractions of its chamber, driven by an inconcatenated electrical conduction system that ensures each heartbeat is perfectly timed. This consists of 5 components, which are the SA node, the AV node, anteroventricular bundle of His, the right and left branches of bundle of His, and the subendocardial Purkinje fibers. It all starts with the sinoatrial node, which is the SA node, located at the upper right atrium, which is known as natural pacemaker, because it generates electrical impulses and initiates the contraction of cardiac muscles producing heartbeat. The electrical impulses will cause both of atria to contract simultaneously, forcing blood into the ventricles. The AV node is stimulated by the SA node impulses and generates its own electrical impulses. The bundle of His and Purkinje fibers conducts the impulses to the whole ventricle wall. Both ventricles will contract simultaneously and blood will pump out of the heart. Moving on, we'll go to the cardiac physiology, which is the cardiac cycle. There's 2 terms that we need to know, which is systole and also diastole. For systole, it is the heart muscle contract, and diastole is when the heart muscle is relaxed. So in the cardiac cycle, the systole is the phase when the heart muscles contract, pumping blood out of the chambers. Diastole is the phase when the heart relaxes, allowing the chambers to fill with blood. During atrial systole, the atria contracts, pushing blood into the ventricle. This phase ensures that the ventricles are filled with blood before they contract. In ventricular systole, the ventricle contracts, pumping blood into the artery and the aorta. This phase is crucial for maintaining blood circulation throughout the whole body. During diastole, both of the atria and ventricles are relaxed. Blood flows into the atria from the veins, and the cycle is ready to start again. So the cardiac cycle, it will produce 2 main heart sounds, which is the loop and the dub. So the loop sound is caused by the closure of the anteroventricular valves during ventricular systole, and the dub sound is caused by the closure of semilunar valves during diastole. Last but not least, it is the clinical relevance, which is arrhythmia. It is the irregular heartbeats and occurs when the electrical signals coordinating the heartbeat does not work properly. So we will be more focusing on the supraventricular tachycardia, which is SVT. SVT occurs when there is an abnormal electrical pathway bypass or the AV nodal checkpoint. As a result, the heart rate accelerates and the ventricles contract before they are properly refilled. These ineffective contractions may cause lightheadedness because the brain is not getting enough oxygen. So here are the symptoms of SVT: palpitation, shortness of breath, chest pain, and sweating. And SVT can be caused due to cigarettes or smoke because the chemicals in cigarette smoke can damage the lining of the blood vessels, leading to endothelial dysfunction. Next is caffeine, which increases the force of heart contractions by raising the level of cyclic AMP, which can affect the heart's electrical activity. Lastly is the alcohol beverages. And then next, this is the risk factors of SVT, which is anxiety and having lung disease and heart issues, and serious case may lead to heart failure and cardiac arrest. One of the few ways how SVT can be diagnosed is via electrocardiography. So during an SVT episode, the ECG can show a rapid heart rate with a regular rhythm. Next is a Holter monitor. So this is a portable form of an ECG, the device that is worn for 24 to 48 hours. It can detect intermittent episodes of SVT that may not occur during a standard ECG. And lastly is the tilt table test. This test evaluates how the heart and the blood pressure responds to change in position. The patient lies on a flat table, which is then tilted to a standing position, which monitoring heart rate rhythm and blood pressure. And the treatments, medicines that can slow down heart rate, for example, is like adenosine, atropine, and beta blockers. And one of the procedures that can be used are such as the implantable cardioverter defibrillator, which is ICD. This is a medical device that's surgically under the skin of the chest. It consists of a battery and thin wires called leads. So this battery-powered device can deliver electric shock to correct life-threatening arrhythmia and prevent sudden cardiac arrest. Moving on is the prevention of arrhythmia. So firstly is to eat a heart-healthy diet. So this provides essential nutrients and help maintain healthy blood pressures and cholesterol level, leading to reducing risk of arrhythmias. Next is to limit alcohol and caffeine. So this reduces the likelihood of triggering arrhythmia, as both can stimulate the heart and cause irregular rhythms. And lastly is to maintain a healthy weight. So lessen the strain on the heart and lowering the risk of developing arrhythmia and other heart-related issues. And that is the end of the presentation. Thank you for your attention.